We have open spaces all over the place. And that's what's holding him from going back. Even though he basically looks like he has a good extension curve, it's not good. Because he has all that trouble down there. And now when we look at him from the back, you're going to find out how much trouble he really has in that area. Okay. Now look at that. Stop it. Now back it up. See, I basically like to stand in front of this machine and take all my listings fresh. Because then if a patient makes a mistake too, I can go back and double. But look at that. He has like a bow and arrow in his neck there. It just bows like that. But yet from the front, from the side, he had a pretty good cervical curve. So whenever you have a person that's binding, inflection and extension, we right away want to see, we think we have to find something in flexion and extension. It can be this. I mean, these are couple motions, and one will affect the other. So on this particular case, this picture here is more gross than his lateral cervical. Yeah, this is a more gross. This here should take more analyzing than anything else. Now, let's watch it. Now on this, let's watch the cervicals first. Forget about the dorsals. And see, a 7th cervical does it really good. Now let's do that over and go down and check the dorsals. You can't check everything at one time. There's nothing. Now, we would want to adjust all them dorsals on the right side. See? But, they're already bent to the left. So it would be ridiculous for us to go in and hit him on the left. The rotation is left. And the reason it's not moving to the left is because what? They're already over there. So what's our best way to go? Put your fingers there on the first dorsal spine, on the transverse. Right there. We want to go there, and there. And look at third, and down third. Look at it. We're all messed up. See? Yeah, he's coming down like this. Yeah. All kinds of problems. How many years you been under chiropractic care?
7.
And you'd really be mad at somebody that taken care of your car for 7 years and the fenders rusted off of it. See, people put more emphasis on their cars than they do on their body. He's not mad at the people who put his spine in the shape.
Some people rather pay for the car repair too, rather than pay the chiropractor.
Oh, most of them. I had a woman come to me one day. She said, Doc, I got the insurance money for your work, but my dog was sick and the veterinarian won't take care of him unless he gets cash. So I used your check to give to the veterinarian. Veterinarian has the best job in the world. Yeah. You don't hear none of the animals ever complaining. Now see, this man got trouble to burn. Trouble to burn. Let's go over here. You know how he got these big muscles? It's them weights, didn't he? Weight lifted. He has what does spines like this. Weightlifting makes a beautiful young horse. What we'll do on him, we'll do C5 and we'll do 3 dorsals. Isn't responding because you hit it too many times on something. If it's not responding, see, you've been here playing around. Yes, you have.
That's the first time I poked it.
There,
that's right. There, lose one.
But it's not.
You pressed it too many times.
No, no question, I'm turning. That loose wire was doing it. No, we're off. No, I'll just shut this off. We'll start all over. Then we'll have to wait a couple minutes to bring that back up. Who wants to go out and see the new clinic? Okay, we're going to go, right? And as soon as I adjust him, we're going to go. Then I'll adjust everybody else later. Oh, well, I'll adjust you. I can't stand to see a grown woman cry. Two grown women cry. Well, see, that's a very, very compatible individual there. That's okay. If you're going to cry, we'll take care of it. I mean, we hate to see a grown woman cry. Don't we, guys? So we'll do you. No, we don't want you crying and all the way out there saying, "Well, baby."
Dr. Bruce, I was meaning to ask you on the hard copy, when you fold them over, what's the purpose of that?
To see if I can lay one side over the other.
That's it?
That's all I'm doing. And I can see I can lay them over top. I just do that to show people.
And if it does, if they lay over nicely?
Then what? You tell me. If you can lay one side of the pelvis over the other side, what do you have? So then what do we say?
Don't adjust.
Yeah. Now why did you have to ask me that question? You already knew it.
I just was wondering
wanted
if there was
to
anything
verify.
addition, if there was anything
You
else.
can do that with them. Chances are you don't have nothing to do unless it's been a recent injury. See, a lot of times when something's a recent injury, you can lay it over top of each other if it's a double PI. Then you have to do something about it.
Even if there are things that are looking like they're wrong as far as the obturators, or
Huh?
if the obturators are not almond shaped and other things show you that, when you're looking at it flat, that it might be, something might be wrong, but then you hold them and they're symmetrical, then it's still not.
No, you're not listening to me. If you can lay something over top of each other, there's usually nothing to do there. It's usually a compensation from up here. Or it's a very fresh injury and you have to go down there and do something about it. But if they're almond shaped and there's pain down there, you do nothing. But if they're double PIs or double ASs and there's a history of an injury, then you got to do something. Okay. You got the difference? Arm doing a Watusi twist. I mean, you bunch of wimps. You find an excuse to come to work. You hear people say sometimes. You know why? Because they're supplements. Give this man a thing. Now. myself it was hurting my wrist. I'm not interested in my wrist. I'm interested in this guy's spine. I don't have time to worry about my wrist hurting. You're gonna give me a dorsal, you're gonna monkey around. No wonder the instrument didn't want to work.
Is that Jesse's hell over there?
You can't tell.
No wonder it's white. That much time.
Oh, did you?
Want to loosen your pants up? You know the difference between a French lover and an Italian lover? Huh? Well, a French lover, he kisses the palm of her hand, he kisses her palm, he kisses the back of her hand, he kisses her wrist, he kisses her forearm, kisses her elbow. By the time he gets to her lips, it could, I tell you, passing out cigars.
All right. There's a man who knows.
I thought
You can't tell jokes and adjust at the same time. End up with not enough statements. Okay, now, we have to go lumbar, but we leave them go because the sacral's up and we'll see what our cervicals and stuff would do. Good. Now, you remember what he looked like before? We lost that because I shut it off, but they were way, way down, and now he's up. Okay, how about it? Do you have a reading, Ursula? Okay, over here. No, I just said, now listen to me. I said the sacrums are all up, so I let him go for 3 or 4 adjustments, doing cervicals and everything else I had to do. Then if these didn't go up, then I start going after.
Shouldn't you do the post-reading the same way you did the pre-ups?
You can do the pre the same way you did the post, like I did yesterday. When you do it the way I did here, the readings are going to look a little better, but if I get them setting up, they would have came up relatively speaking. But I'm not really interested. Once I make a change, I am not interested in pre's to post if I make a change. What I'm interested in is the next time he comes in, what his pre looks like compared to the pre. Now I remembered what Hal's reading looked like yesterday. Remember I told you I had a low dorsal that I adjusted? Today, that thing was all the way up. And of course, if I wanted to go back and check any of these, I could. But when you're running 100 patients a day, I like to adjust people setting up. I have them laying down. If they need another cervical adjusted, they're going to get it laying down. This is the best way to do it. But when you're doing 100 patients a day, you can't do everything exactly the way you would do it under a research condition because you don't have the time. Jim Beatonbaum doing 70, 80 patients a day. You don't have the time to lay a patient down, get him up, and lay him down, get him up. Yeah. But your readings are a little bit better laying down. So if you have a person who's having a lot of dorsal trouble and you can't find it, sometimes maybe you should set them up and read. See, you have to keep in mind, instruments are only instruments, and they're only as good as the person using them. And you have to know what their good points is and what their bad points is. But if I do a couple of her cervical setting up and then I post-check and I decide I better do another one, I'm going to do it laying down. But it all comes out good. And that's why you have the dermathermograph readings to back you up, to make sure. Now, if I did a dermathermograph reading and I wasn't real happy, then I might put them back over here and do some more. Where's your cream post? I bypass them. I mean, once you get to know your patient, the secret in a busy office is to be able to do as many patients as you can under good conditions. And if there's somebody who consistently has good sacrums, why keep checking them? You might check them every third time or something like that.
Dr. Puglisi was saying he doesn't do all his patients with that case on water. He's always doing remote dorsals and everything like that. That's why he introduced it.
Okay, now, we did 3 on her one other time. We did 4 on her yesterday. We can do 5 on her today. Okay, let's go at it. Let's see if we can make her do the what, 2C twist.
What do you want? What do you want?
35. I mean, why should she get anything less than everybody else? You hear him, Ursula? He wants to treat you different than other people. Feel that in your fingers? Okay, now that only took 10. But see, when they're up high like this, very seldom do they take very much. But you ought to have seen how bad she was when she was in Pittsburgh. Tell them how much better you feel.
A lot better.
And this is only the second time I've ever seen her, would be the third. How many times did I adjust you in Pittsburgh?
Once.
One time.
What do you measure exactly when you go with an instrument? What is it that you...
I measure the resistance of her instrument, her body to the force. I'm happy with that. Let's do 1, 2, and 3 sacral. Take one to the toes.
A little bit. Mostly on my left leg.
How about that one?
A little more.
A little more? The first one didn't go at all, and the second 2 did.
Yeah.
Yeah. Well, see, I hesitate even doing the first one. I figured the second one was by far the worst. But I do them all. Okay, let's do her neck. Tuck your chin in. Now, when you're up here, you have to be real careful. That's the occiput. You just turn the instrument. That's the atlas. Then you just turn a little bit more. That's the axis. So the first 3 are very close together.
Save it for your taxes.
Okay.
Okay, now see, that brought her atlas and axis up good. Her third now is the lowest one. The next time we check her, we might have to go back and do her third again. But I'm happy we made a nice change.
Are you going to visualize before you do anything else, say, in the next?
No. I have picked enough things off of her. We going to do the lumbar, or are we waiting?
Yeah, the damn house is working.
Yeah.
Can't get good help anyway.
What criteria do you say you might go back and adjust the cervical remote? Well, situation.
If I hadn't made any change at all. Don't talk to me when I'm working on people's high ends. I forget. See? I'm happy. I'm very happy. The one that went to her toes the best is the one that got the best change. Out of here.
And that'll affect all the others as well.
Okay. Oh, absolutely. Do you think I'm gonna let you go up there and say, well, he did her, but he didn't do me? I think he likes girls with longer hair than he does girls with short hair. And it isn't true. I like them all equal. I love short hair. That's what I told the barber. I come out of there, I didn't have hardly any. I found one thing. Don't ever sit in a lady barber's chair and ask her if she was married. Oh. Yeah, she said, yeah, let me tell you about that Uncle Baxter. I'm not kidding. When I come out there, I look like Jim Beatenbaum.
Aren't you cute?
Let's do 5 of this young lady.
You've been hiding that ball spot all these years.
That's all right.
That's okay. Cancel.
How do you do that?
I go get my sheet.
Select for
I don't know. You tell me what you do.
I just said,
You did that twice.
are you ready? Just ready to do it.
There we go. Put it in your fingers. Paper? Let me see.
Yeah, screw that. And the tissue paper. Got some fresh kiwi.
She went up in temperature 1.4 degrees. And the change in the reading is phenomenal. Biggest change in her too, again without the blood. Great. Very seldom do you fail to clear anybody out. That's good chin in. Now see, she has all kind of anterior dorsals here. Did you have a lot of adjusting in here? Yeah. Everybody likes to adjust dorsals because you can pound them so nice.
From the posterior.
Who knows? How did you get them? You really pounding a Pete A. Huh? No reading in there. Let's do her second and third sacrum. Feel that into the toes. The record adjustment was 1,467 adjustments on the first sacrum from a chiropractor. You know, we kept track of who had to get hit the most vertebra. Huh? Fuel was in it, yeah. And 27 of the 30 segments that held the record was chiropractors, chiropractic students. Only 3 people held a record who was a virgin chiropractic patient. That tells you something. Okay. Now see, that reading I'm not happy with at all on her. I'm not happy at all with her reading. So we'll go to the dermathermograph to see if it changed it. And then we'll check her again later. But I'm not happy at all with her reading. Just nothing came up on her except axis came up some and the lower two dorsal come up. But they could come up later. I wouldn't go back in there and start pounding anything.
Only if you made no changes at all.
I wouldn't go back anyhow. She's not an acute problem. I'd save her for another day.
She was acute, would you possibly adjust the office?
No, I'd wait. See, I made nice changes in the sacrum. Maybe I expecting the brain in the wrong place. So I'm real happy with the sacrum. So you'd be surprised how much time when you get a change there, that'll change that. So we'll check her again right after lunch. Okay. Tease. Does everybody know how to get to the property? Huh? You're gonna go with me, so you'll know. Here, and this will be the dressing booth, and that'll be the x-ray room, and that'll be the control and dark room over there. And 4 adjusting rooms. Isn't this nice? And then this will be, see, the dark room will also be the control room. This will be, I notice have a door that will close over it. And the x-ray will be there. Dressing booth.
Gonna pass out.
4 adjusting rooms. Consultation room, x-ray room. Right there. This is my adjusting room, and my private office will be over there. And then this will be
Yeah, as long as you can pay the bills.
Whatever, if I had to primary return,
there. And this will be built in circles. And then back here we'll have a projector room where the projector will hit the screen. But every one of these will be built up 8 inches over the one below it. And then they'll have built-in counters and chairs.
Did you design this whole layout?
And then that's the back exit there.
what all you got downstairs?
Huh?
What all is going downstairs?
Downstairs will be a technique room down here.
He's gonna put a pole right there so you can...
Door going out to a patio. And this will be a kitchen. So that we will have, this will be a door, we'll have another window there. And then that's a men in the ladies' bathroom. This will be a nice kitchen so that when we have a seminar like this, I'll have everything catered. And we'll have 2 or 3 tables here, and then we'll have tables out here on this closed-in spring porch, and we'll have picnic tables around and everything. So when we do a seminar, it'll be all self-contained. would be Chirp's office. That's where, you know, them, if somebody wants a ruler or something like that, it's right there. You know, so it'll be a lot different than. And start insulating all that. I'll have my furnace and electrician, they'll be done directly.
Chris.
You know, once they do that, then we'll be ready to close up. Come a long way, didn't we?
That's good.
Forward.
Cracking good.
Yeah, that was, no, nothing was here, not even a hole. And see, our stones already come. Yeah. And we're closed in, you know.
How long did it take to build Larry's office?
Oh, it took us 6 months. Yeah. This is probably gonna be the fastest job we ever did. Yeah. Not quite. This is
Is it amazing how much colder it is in the concrete inside than it is outside?
Sure.
Is it a plumbing business?
Right there.
What was that?
Like this?
How hard do you want to? You're associated with bad company there, Lynn.
Really bad.
This is a 230 table. This is a table that I was designed specifically to do our system with. It has the drop head piece, drop dorsal piece, a breakaway dorsal section for the pregnant women, and the pelvic section for doing pelvic adjusting. That's what you need to do this work with. It has a key dimensional headpiece, which has a forward motion drop, it has a circumduction, and it has 3D. Now this is what you call 3D. The headpiece can swivel 15 degrees in either direction. This is what you call circumduction. The headpiece can circumduct 12 degrees in either direction. When you put a patient on a table, they should be laying as if they were walking down the street. This is the occipital roll. This is used to adjust occiput's locked in extension, atlas is locked in extension, or a combination of the two locked in extension. They used to be all black, and then some people marched on me, and I had to make some white ones.
More work you're doing than you can, you better make some yellows.
Now you put this roll right up against the occiput, and you lay the patient's head on this flat. That way, whenever you adjust them, the roll doesn't slip away from you. Never let the head float in space. If the head is not touching the table, you use this knob here to bring the headpiece up to the patient's head. That's how you hold the patient's head. And then you drop the table. None of these people work for me anymore. This guy used to be my head carpenter. And he thought that the project I undertook up here at the lake was too much, so I fired him. Now this is an occiput in extension. You get underneath the external occipital protuberance. And you put this board down here to hold your arm up in case you're tired. Everybody always wants to know what that board is. This is just a model, a cervical model, and that's the stand it sits on. And that's how you adjust them, just like that. You can use the 3D part of the headpiece to put the patient into flexion and or extension. Because when you're going to adjust for laterality, no matter what you're adjusting for, you always should take in consideration all the other things that is wrong with that segment. So you set it in such a way to, when you give one adjustment, if you bind the vertebra in another direction, chances are you can help that too. So if you're going to adjust for laterality, and the patient is also locked in flexion, then you should put their head in flexion before you adjust them for laterality. You understand that? You understand that, Kenny?
Yep.
Huh?
Sounds good.
But do you understand it?
I can see why you wouldn't want to lock a vertebra and then try to cleave through it.
Okay, then, if it's in an extension, you do it that way before you toggle. And the best way to do it is have a backward drop on your table. This table has a backward drop. Now, the only way you make a backward drop out of your 230 table or whatever table you have is you have to cut a piece off the headpiece. Underneath the headpiece, there is two pyramids, and they hit each other. That's what keeps it from flopping back and forth. Now, when you adjust an atlas, with that headpiece on the backward drop, that person will get the best adjustments you ever gave them. Now, I had to make them because the factory don't make them that way. But all you have to do is take 4 screws out of your headpiece and get this off of here. And then you saw off the train. And that makes your headpiece a forward motion drop or a backward motion. When it's forward motion, you'll notice the headpiece is not level with the table. It sits forward. Instrument adjusting on the atlas is much better than hand adjusting, because when people do hand adjusting, they forget that the atlas is not right sticking out there for you to get on. Number one, it's just a little bit below the mastoid. Now, when you put a 1/4 inch of tissue around that mastoid, you're down covering the transverse process. Then when you figure about your fat little patty here, your plexiform's not over here, it's in here. There's approximately a 1/2 inch of fat around it. So when you slide off the mastoid and you think you have that right on there, you're probably down about axis or 3rd cervical. Of course, I love to toggle, even if I know I'm not in the right place. Now, her question was, when I do a laterality, do I use 35? No. It's too much. You should do 20. Because that's too much. That's a very sore spot. Never in my life did I ever think I'd turn to instrument adjusting. Because I always lived with the definition that chiropractic is a philosophy, science, and art of things natural, a system of adjusting the segments of the spinal column by hand only for the correction of the cause of disease. So when we tried to adjust an atlas from the back, it was just absolutely impossible to do it without an instrument. So we looked until we found an instrument that would work. And that was the instrument that we came up with right there. We have many different probes for our instrument today, 4 in fact. Now this is the Atlas probe. Now Now we're adjusting this atlas. This is an atlas that appears like what, Jesse? If you're looking at a flat lateral, what type of an atlas am I going to be adjusting here?
That'd be a superior.
Superior plus or plus plus, I'm coming up underneath the posterior arch. Now my instrument is almost laying on the patient's back. You have to get underneath there. Now you can see my line of drive. Now if he wasn't such a hippie and I had to hold his hair up, I would have been holding the instrument down with my fingers. And that's the way I would be adjusting. But if you hold these down, then it doesn't slide up. Now we're adjusting for an inferior atlas. An inferior atlas is a lock between two what? Want to tell me? Atlas, absolutely. So we're coming directly on the posterior arch. Our line of drive is completely different. You see that? Because we're coming right in on the posterior arch. I haven't damaged any yet. I'm glad you told me they were there. Haven't damaged any yet. There they are right there. See them? They're not up over here, arch, they're above. They don't have a nerve supply, they're going to dry up anyhow. We used to think we could get underneath this posterior arch with a single probe. Absolutely impossible. Except on a patient who is set at a perfect superior. If they're superior plus, the posterior arch gets so down on the axis you can't get it. That's why we had to come up with a double probe to get around it. Now when you're adjusting, you have to keep the right line of drive regardless of what you're doing. Now when you're doing laterality adjusting, if this atlas, let's say, was left and posterior, you could take the posterior part out of it by cranking your circumduction part of your table, and that would bring your whole neck forward. Then your adjustment would be straight up and down. Here we're adjusting for laterality of the axis. We're doing our dorsal adjusting here. If I could think of a way to take some of this hair off of here and put it up there.
Hey.
Well, then I'll sell you some.
What's wrong with that? What's wrong?
Whenever you're going to toggle a neck, you should put the chin at the bottom of the headpiece. Axis. Remember, axis, you have to get underneath it. Now, when I used to do this by hand, I'd almost lay on the patient's back to get enough inferior to superior line of drive. The instrument has a nice probe to use that with. Remember, keep your right line of drive regardless of what you're doing. Notice I'm going in there at a 45-degree line of drive. What type of pelvis is this, Brian? Brian!
Yo. Normal.
Was you sleeping?
No, I was thinking.
Yeah, what we smell burning. What type of atlas is this, Lori?
What type of what?
What type of?
That's an atlas, I see an atlas.
Huh?
It's a double PI.
What happens to this curve on a double PI? Lori?
Flattened.
Right. This is a double PI with a major and a minor. That is the normal versus the PI. To do a PI, you lay the patient on their back. If you look back at Kenny, he'll show you how you're supposed to hold your hands. Show them, Ken.
This is the sign of Pierce.
May Pierce be with you.
Pierce be with you.
You take your hands like that and you put your chiropractic index finger up on top of the iliac. Your thumbs should drop right down on the pubic arch. Then if you merely bend your thumb, your thumb will go to the exact contact point. Don't move your hands apart, just merely bend your thumb. And your thumb will come down in a groove halfway between the symphysis pubis and the edge of the iliac. I normally, when I have a woman in my office that has a dress on or a skirt, as I do this adjustment, I will usually cover their legs up so that I can feel free to pick their legs up and twist them around, do anything I want. The line of drive will be from superior to inferior. Your fingers will go straight down the spine. Do not get your fingers over on the edge of the iliac, or you will stop the adjustment from taking place. You roll in as carefully here as you would on a mattress. I usually pick up the opposite leg, and you stand on the opposite side to give this adjustment. This is a one-armed adjustment. Watch your elbow bend. Don't put them in the basement. This is a normal versus the AS. You go to the ischial tuberosity. You can thrust with one hand at a time. You can stand on either side. Or if you have a pelvis like this, you can do them at the same time, like this. And what happens to a AS pelvis, Michael, what happens to the lumbar curve?
Goes back to what about it.
There's how you do them both at the same time. I like an Elvis Presley sideburn. See how I used to have nice black hair until you people drove me to drink? What type of pelvis do we have here, Kelly Estes' brother Kevin?
That would be a DX
On what side?
on the right.
What's the other one?
The other one's normal.
Okay. Where would you adjust this person?
The right side of the sacral base.
Right side of the sacral base? What tubercle?
Second.
Right here. Jim Beatonbaum, where would you adjust this person?
Right side, sacral base.
Right there? Okay. Ken, where would you adjust this person? Yeah, you. There's no other Kens in this room. Back there looking all over. We're talking to you, buddy.
Now that we have lumbar body rotation, we're not going to go for the EX. So,
Why all this dissertation? Why don't you just tell us where we are? We don't give a damn where we're not going.
as I'm trying to remember what we would do here.
Yeah, you're
I know it's-
stalling for time is what you're
I know we don't go to the EX with lumbar body rotation, so we hold some, we do
Lynette, tell me
Logan,
what
we
you
do Logan Basic and hold on the high transverse.
No, that's a good way of getting out of it. How about, you're going to adjust on left side, the second sacral tubercle, because the rule says if you have an INEX with lumbar body rotation, you will adjust on the side of the lumbar body rotation. Right, Lynette? Yes. I'm glad I'm not going to go out with him. We wouldn't know where the hell we was going. He'd tell us every place we wasn't. Ursula, what type of pelvic is this? Huh? I mean you can't tell. Look at this wide ilium here, and a narrow obturator, and a narrow ilium, and a wide obturator. Oh, forget the angle. We're not worrying about this. We're talking about this. What's this? If you saw this on an x-ray, what is that? Now why all the monkeying around? You knew it all the time. What's this one? That's all. This is the normal versus the IN. This is the normal versus the EX. This is how you take the contact. 3 fingers. Your ring finger is on the edge of the ilium. Your regular index finger is on the sacral spine, and your chiropractic index finger is on the point of adjustment. And you pull the tissue down to the inferior, like that. You stand on the opposite side. That's where you want to be, right in between there. You know, there's not much room in there. And you figure out the sacral spine, you have 2 places to put your finger, and you've got 2 ilium covering up the sacrum. You roll in like that with a real high arch. Like that. That would be great if we could get in there like that to get an adjustment, wouldn't it? No. Yeah, do whatever you want to do. You see that nice pink outfit I have? That one's for adjusting the girls in the pink one. The blue one was for adjusting the boys in the blue room. And I had a black one. I had black shit for that. Tuxedo. Yeah. Normal versus the IM. If there was any lumbar body rotation, you'd adjust on the side of lumbar body rotation. But that's what was there for. That wasn't saying you'd ever find that. We just wanted to show you what they were doing. That wasn't saying that that patient had that, because you'll never get that. I've never seen it. You want to know where I got the pink outfit? Robert Q. Lewis, that's who the outfit was made by. Oh, and then I got screwed up here. I'm adjusting the guy with the pink suit on. No wonder I'm getting the roses from the guys. Did you say, how do I know it's a guy? See the pink pants? Right, pink pants.
Robert who?
And maroon boots. Maybe I'll wear that outfit to next meeting. I still have that. If you guys promise to bring me flowers. What?
Do you recoil with that adjustment with these, any of these, or do you hold the cover that?
Doesn't matter. The main thing is you hit them. The recoil has nothing to do with
Well,
it.
I just wondered.
You really don't suck the thing back through like Sid says.
You don't want to suck anything back through when you adjust it.
The reason I asked is because I figured it might be more painful one way or the other. Usually the
Nah,
recoil.
just get on there and hit him. Sid's the only one with a sucking face. Doesn't he have a sucking face in form? He says he does, doesn't he?
That's what he says.
That's not so bad.
Who, Betty? Does she really say that?
Yeah, she says that.
Well, I know Sid can do that, but I didn't know Betty could.
What's that?
Betty used to palpate x-rays, Vern, remember that?
She can palpate x-rays. I heard a
With her
guy
eyes closed.
that could palpate a hair through 16 sheets
She
of
used
paper.
to make us try to do that.
Yes, you
Palpate a hair
She
through
used to make us try
Through
to
the
do
telephone
that.
book. Reggie Gold can do it through 500.
telephone book.
Yeah, she used to tell us to try to palpate a hair through a telephone book.
Who could?
Betty.
Brian would cheat and use cubes.
That's how we learn how to
By walking by, huh?
Look at the horsehair.
Well, there's only one thing about it. I never adjusted a hair, so I never,
Like palpate it, yeah.
no sense in palpating it.
Never adjusted a tire either, but we played with that.
Hey, do you guys want me to wear that pink suit the next time?
Yeah, tomorrow. You still got it?
Tomorrow,
I
yeah.
got it.
What kind of shoes?
Bring it in.
Probably doesn't
Tomorrow.
fit though, does it?
Yes, it does.
You have any platform shoes?
No, but I can get the maroon boots out.
All right.
Okay.
Do you want me to come in on my maroon
Oh, there we
gold
go.
wing Honda
Yeah, man.
with my maroon helmet and maroon leather pants and gloves and the pink scarf?
Take all the ladies for a ride.
Yeah.
Yeah, you have every twit in town following you.
That's why he's gonna do it.
Yeah, Guitar Man would like you. You know Guitar Man? Bridge Boy?
Oh, yeah.
Yeah.
Okay. There, I got the blue outfit on. I'm adjusting the young lady.
You were screwed up.
Yeah. This is Logan Basic. What Logan Basic is this, Ken? What's,
We want to, a right side.
okay, what
There you
one
go,
is this?
Ken. You got it.
Yeah.
On the Logan Basic, you saw.
Yeah, go ahead.
Well, you said, like, on the.
I'm going to show you. I'm going to show you.
Okay.
I'm going to show you.
All right.
This is where you're adjusting to the sacrotuberous and sacrospinalis ligaments right here at the tip of the sacrum. There he is. He's holding the left Logan Basic. There's his contact point. The other finger's going up the spine looking for taut and tender fibers. See his arm? See? Right side, left Logan Basic. See that? Holding a baseball. His hand is down on the table. Superior line of drive. Up, up, and out. The left Logan Basic. Now, the left Logan Basic points to the left shoulder. The right Logan Basic points to the right shoulder. He's pointing to the left shoulder. Everybody must read Chiropractic A New Beginning before they're ever allowed to enter the office. Then they stand up and get their dermathermograph readings like good little boys. Logan Basic on little kids, you check their gluteal fold. It will deepen and turn to the side of Logan Basic. This is a right Logan Basic. And then you merely hold your thumb there and hold that pressure. If you're learning Logan Basic, you should try to do it on somebody in the nude. Well, not really the nude, but they should at least have their pants down so that you can find where you want to be. And it's one of the best adjustments in the world. On kids, I'll usually use the instrument to find out which side of their atlas is cold, and then I'll go to work on that. That used to be our lecture room down in Florida. That was our lecture room. Remember, you was there, Shauna Walk.
Yep, I remember.
And then we made this lecture. These things here really made the trip. They came from my lecture room up in Pennsylvania. Then I took them to the lecture room down in Florida. Then I took them to the lecture room here. And we'll move them out to the new lecture room. And that's it. I'm not moving them anymore. I don't have to be round, you make them. They're not really round, them buildings anyhow, they're 28 4-foot pieces. Yeah. So this will fit in there, we'll just have to angle them and make a new top. And then we'll have a screen, and then we're going to put the projector back in a cupboard over here and get a big thing so that we won't have to have it here anymore. And of course, we can have a garage sale and sell all of these chairs because our chairs